So next, we will have Professor Mark Lawler. He's a professor of digital health at Queen's University Belfast and a scientific director at DataCan, the UK's health data research hub for cancer, and chair of the International Cancer Benchmark Partnership. Professor Lawler's pioneering work on COVID-19 and cancer received the prestigious European Communique Award. As lead of the Lancet Oncology European Groundshot Commission, his recent landmark study highlighted the significant gender inequity in senior leadership of cancer research. And so let's welcome Professor Lawler as he talks about gender inequity in cancer research, a time for action.
Thank you very much, and thank you very much to the organizers. You can't fix what you can't measure. Just what the CEO of Cure said, and I'm going to talk about that because one of the things I really very much believe in is the ability to actually measure things. And because people make too many opinions count more than evidence. And I think opinion is the lowest form of evidence, and it's really what I want to do today is just show you one aspect of how data-informed intelligence highlights gender inequity, particularly in female cancer researchers. About 2 years ago, brought together an equal number of female and male researchers from right around Europe and patient advocates. And what we decided was we needed to look at cancer research. We did the most comprehensive analysis of cancer research in Europe, and we did it to really identify what were the key things we weren't doing rather than the things that we were doing. And one of the areas we focused on was inequalities and inequity, not just in relation to female cancer research, but also in relation to inequalities that people were facing every single day of their lives, particularly in Central and Eastern Europe. And we wanted to be challenging, so we challenged the research efforts and we said, how can we actually do better? And we came up with 12 draft recommendations and a call to action to really reimagine cancer research and its implementation right across Europe. Because too often, opinion, even expert opinion, mostly male, grey-haired, silverback opinion, was actually dominating what we were doing in cancer research in Europe, and I'm sure it's exactly the same here in the US. We came out with 12 recommendations. I'm not going to go through them, but number 6 was one that we highlighted that we seem to see an inequity in relation to female cancer research leadership in the cancer research that was being performed in Europe. So we focused on that in more detail, and we did what was the largest study and still is the largest study on gender bias in female cancer research leadership ever undertaken. And what we saw was really shocking. I'm just going to take you through the data. What we saw was that countries like Japan, less than 10% of the leadership in Japan in cancer research was female. In the US, 25%. In Germany, 24%. In the UK, 32%. In Switzerland, 35%. That is just not acceptable. These are meant to be powerhouses of cancer research in Europe and globally, and yet they are biased, significantly biased, towards one sex. And what was interesting was when we looked to see of female cancer researchers who were public in cancer research as early career researchers, as PhD students, it was 50-50, so 50% even. So it's not that there are less female cancer researchers, there are less female cancer researchers in leadership positions, and that's just not acceptable. What is interesting to look and see is that there were some countries that actually were reaching a 45 to 50%, or certainly in that level, and it's interesting to see where they were from. They were from Eastern Europe, and they were from Scandinavia. So you can see there I've highlighted Romania, Croatia, Slovenia, and also Sweden, Norway, and Finland fairly close to that. So why would that be the case? Well, the reason is, we think, relatively straightforward. There are obviously a number of factors in relation to how people actually employ people and promote people. But one of the things that we see both in those countries in Central and Eastern Europe and in Scandinavia is better healthcare in relation to, better childcare. So what we're seeing is support for female cancer researchers to become leaders. And in some of the other countries, that's obviously not the case. So we need to learn from the Central and Eastern European and Nordic countries and really use this data to change the way because we're not doing it appropriately. And what's worrying to me and to our group as we came together was this will also reflect in the topics that people choose to actually research on. So it's not simply a case where we're saying, oh, well, there are less female cancer researchers who are leaders. It'll mean that those leaders are not at the table when decisions are being made in relation to what is the actual research we're going to do. And therefore, there will be a natural bias there, as well as the bias that's already in place by the fact that in Germany, 24% of cancer researchers are female leaders, as opposed to what we should be seeing somewhere between 45 to 55%. So really, we were disappointed by this data, I'd have to say. We were quite surprised at the level of it, but maybe we shouldn't have been. Maybe we were just somewhat naive, but we certainly felt that this was something that we need to do. So we came out with a recommendation to say that we need to go between 45 and 50% by 2028. We've already started putting people to task and starting to look and to see, are they making it? We've looked at Ireland and Northern Ireland as a sort of a marker, if you like, and certainly we're seeing a difference, an upward difference, which we're obviously very pleased about. But we'll continue to ring out the clarion call in relation to this. It's really important because not only, as I said, does it reflect cancer research leadership, it also is going to reflect cancer research decisions. And lest you think that cancer research doesn't really matter as some added extra in relation to cancer care, that is emphatically not the case. Our commission showed that people who are treated in research active hospitals have better outcomes than those who are not. So cancer research is not a luxury, it's a necessity, and it's an integral part of 21st century cancer care. And just to end, I'm going to totally switch tracks and go to my favorite author, James Joyce, an Irishman like myself, and his characterization of the husband of Mrs. Carney. Mrs. Carney regarded her husband as something large, plain, and reliable, like the post office. And though she appreciated the small number of his talents, she appreciated his abstract value as a male. Those of you who want to hear any more of that, I'm actually performing in the Dead Rabbit this evening at 7 o'clock. So come along, tickets still available, and you'll see another side of Mark Lawler, PhD, MD, whatever I am. Thank you very much.